So I'm going to teach you some really gentle exercises, some fascially based exercises that you can do with your clients where they are in control, and they can see sometimes even quite immediate results. Whiplash is a really interesting condition. It's a real example of the biopsychosocial model that we talk a lot about in Jing, where pain is actually a combination of not just biological factors, or in massage therapist case, we're usually looking at soft tissue factors, but also psychological and social factors. And in whiplash, actually, the research shows that people who've actually seen it coming, like your client, Rhonda, the pain is actually much worse, because there's a lot of fear in there as well, because you actually saw, this thing sort of about to happen. So generally, there's a real combination of emotional stuff, trauma from the accident, and locked down tissues. So I would say, in my experience, fascial work is absolutely the way to go with whiplash. But you have to take it slowly at the client's own pace, and just gently start introducing movement. Also, within the Jing model, we talk about using different modalities. And the first thing that we always do with chronic pain is heat. So if you have got a client with a neck or a shoulder problem or whiplash, then you'd absolutely recommend, before you do the self-care session with them, that they apply heat. So that could just be a normal hot water bottle. That would be fine. These days you can get some quite nice things, like sort of snaky things that you can put in the microwave and put around your neck, wheat bags, that kind of thing. Kate's saying she just started working with a lady who had been in an accident and had whiplash just before lockdown. Okay, well, great. So this would be some great stuff that you can give them. And Francis saying people won't let go of their head. Yes, that's very true. Okay, so some gentle stuff with whiplash. So without a doubt, with whiplash, you need to, or any neck and shoulder tension, you need to start encouraging movement, because often what happens is people are in some kind of accident, or there's neck and shoulder tension, and literally those tissues sort of almost get locked down around the neck. And we know that movement is really helpful for neck and shoulder pain and whiplash, which is why you don't really see people with those big collars anymore. Remember those things that they used to give you? That's really not recommended, because it just encourages a sort of lack of movement and fear, really. But obviously movement can be painful. So what we do with any kind of painful movement is just try and encourage the client to build it up bit by bit in what we call a pain-free range. And often what will have happened with someone with whiplash or neck and shoulder tension is that they start to compensate with the pain. So because they were in pain, whenever they need to turn their head, they start doing this. So turning their whole body rather than actually turning the neck. So a good thing to do is just to actually start off with checking their range of motion. So a lot of you know how to do this already, but it's always good to go through the ranges of motion for the neck. Do you want to do that, Meg, actually? You there? You want to take people through, as a baseline, the ranges of movement of the neck?
Yeah, okay, great.
Yeah.
Yes, I do. Yes, I definitely do.
I knew you did. Your feathery coat.
Okay, everyone. All right, so let's put our hands on our heart, because that's good, because it centers us. So you can have your hands on your heart, or sometimes I get clients to sit on themselves, like sit their hands on their hands underneath. You're doing that very well, okay? And then lift up from the center. So when you're doing a range of motion of the neck, you still need to make sure that somebody is centered, okay? So that's really important, especially about what Rachel just said around people twisting. Get them to breathe out. So every breathe out, go up to the top of your head, and then chin to the chest, right? So that's flexion. And then just check in if you feel like there's any restriction or tightness, and come back up. When somebody does that, you want to observe whether the shoulders have gone up, right? So there's kind of like this, or there's that. So we want to make sure that it's just in the neck and flexion. And we can all love that stretch. So flexion, then coming back to center, and then taking the head back into extension. The instruction here for clients is really try to take the scapula also down the back, right? So those arrows in your back pockets, just drop them back so that it's really in the neck, and then come back. And then come back to center, right ear to right shoulder, and back to center, left ear to left shoulder for lateral flexion. And then coming back to center and going through right rotation and left rotation. And when you're doing self-care, when you're trying to teach somebody to be able to feedback around pain, they might say, oh, like they do in a clinic, like, oh, I don't know, it's a bit tight, yeah, blah, 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 blah. Encourage them to find a base of 0. So can you remember a time in which it felt really free? Can you remember, okay, imagine that is 0. What would you compare this to? When you're doing rights and lefts, you can compare to each other. But when you're doing the neutrals, the flexion and extension, you need to have a base. So, and you can get them to measure both tightness, yeah, or pain, because that's usually the 2 things that people can pick up with.
Yeah,
that is
if somebody's had whiplash or under a lot of pain, you know, the movement might only be there, but that's fine. Yeah, so you're just encouraging them to move within the pain-free range. All right, so that's what we do to start off. So let's go through those ranges of movement ourselves, and I want you to notice a couple of things. So first of all, we're just going to do rotation. So we're going to turn the head. You can sit on your hands, so you're not doing it with your torso. So I want you to turn the head to look over the right shoulder and just see how far you go. So just notice what you can see as you turn your right head, yeah, just slightly to the side or behind you. And then turn to the left and see what you can see. Okay. All right. So one of the principles that movement is called rotation. So you do that with your client and have a benchmark, say, you know, how far around can you see, what can you notice? So you have that as a benchmark. Now, one of the principles of fascial work, those of you who've been on the course, if you do something with us called indirect fascial work, there's 2 ways of working with fascia. One is kind of called direct work. So that's when we're sort of literally sort of loosening those layers of adhesion between fascial layers. The second one is called indirect, which is a little bit more subtle. And this works on the principle of a stuck drawer. So if you've got a stuck drawer, yeah, most of you, it's like we try and pull and pull and pull and it doesn't come out, right? At some point, you might be like, oh, I need to do something different than this. So you kind of push the drawer in a little bit, wiggle it around, oh, and lo and behold, it comes out, yeah? So you're kind of taking the drawer into the position that's easy for it, right? So we do the same with the body. And this is a little bit of a very gentle myofascial release for the body. So really perfect for people with sensitive necks. So if you notice, which one of those movements was easier? So one of them, whether or not you've got a sore neck, one of them you're probably able to turn around more than the other, right? So one of them is restricted, right? Generally, in our sort of therapist head, we think, oh, I need to work on the side that's restricted, yeah? What we're going to do instead is we're going to take the head towards what we call the position of ease, right? And this is a myofascial principle. So we're actually going to get the client to take the head into the direction that's easiest for them, okay? So what we're going to do, we're going to sit on the hands again. So just check again, turn to the right, turn to the left, and just notice which one was easiest, okay?
Okay, I'm just going to tell you my left was easier.
Okay, all right. And then we're all going to turn the head towards the side that's easiest, right? So you're just going to turn and you're going to get to the range that's comfortable for you. And then you're just going to wait and hold and breathe, yeah? And what you might find as you wait and hold and breathe is that you're just able, the tissues start to soften, and you just might find that you're just able to get a little bit further, but there's no forcing. You're just waiting and holding and breathing in the easy position. Yeah, whichever position is the easiest for you. So that's the place that rotates the furthest. You're just going to wait and hold and breathe. That's beautiful. So just breathing in and out. You know, when you do this for your clients, you can also, it's quite nice to play a bit of music sometimes. Waiting, holding, feeling the tissues elongating. As we breathe out, just feeling the head just a little bit, going a little bit further, waiting, holding. That's beautiful. And then slowly, gently, we're just going to bring our head back to the neutral position. And then you're going to just turn to the other side. So just check your range of motion again to the other side and see if there's any change. So now see how far you can go. Yeah? Anybody notice a change? Right. Anne McLean, I saw you nodding. Tell me. Unmute yourself and tell me.
Hi there. Yeah, I got a much bigger range. I was definitely, my left side was a lot more restricted. So I moved to my right, and then when I moved back to my left after that stretch, I definitely managed to get my head further round. So that's, yeah, it's worked. It's good.
Yeah, great. Marvelous. All right, great. Chaba, tell us about that. Chaba's like unbelievable. Tell us your experience, Chaba.
Hi, everyone.
Hiya.
I'm swimming a lot in the sea nowadays, and I noticed that my turning to the right is more restricted, therefore compromises my swimming technique a little bit. So today I was really excited about this positional release technique, and I had about 10-degree difference between turning to the left, which is my good side, and the right, and I felt this lovely, gentle, warming sensation on the actual left-hand side, and a lovely tingling on the right-hand side. And when I turned to the right to check, it was like, oh gosh, I've got immediately the same range of movement without any restrictions. Yeah. So brilliant. Amazing.
Great. You know, and something really simple. And, you know, one of the reasons.
Amazing.
Yeah, great. Thank you. And I think, you know, we can all see how that would work with clients because it's something really simple. You can do it over Zoom. You're not taking them into any area that hurts.
Okay. Yeah.
Force further around the place, you know, the one that hurts. You're actually taking them into what we call the position of ease, waiting, holding, and then actually miraculously you find that the other way, you know, is you can actually increases the range of movement as well.
Question is about how long to hold. Joe's saying she's had a big difference, but how, like, what's your advice there about going to the position of ease?
Yeah, I mean, I think, to be honest, when you're talking it over with clients, I mean, at least 30 seconds. You know, imagine what I did with you is maybe kind of up to a minute, but definitely longer than 30 seconds, and talk them through it. So you're helping them to hold and breathe. Obviously, the more you hold and breathe, the more you're getting into the fascia. But maybe start off, the first one is maybe 30 seconds, and then you could get them to do it again, maybe for a little bit longer. Yeah. And as an exercise, you could maybe get them to do that, you know, 3 or 4 times a day. I mean, it might be actually an interesting thing to say the first one's 30 seconds, you know, the next one's a minute, next one's a minute and a half, something like that. The trick when giving people self-care things is to do the things that they're going to do. Yeah. So it's better to tell them to do the 30-second one, you know, every hour or something like that, than doing something that's a bit unmanageable. Jill Henderson, there's always one. My restriction rotation is worse. Brilliant.
Oh, come on, Jilly, tell us. Go back. Unmute yourself. Does it feel sharper?
Yeah. It's always good to have this because these
good.
with real clients. So go on, tell us about it, Jill.
That's what I thought I'd say. I do generally have restriction anyway on my left-hand side, and I went to my right and it felt great. And now when I try and go, it then felt really tight in the stretch when I was trying to hold it just within the comfort. And then when I came back, it now feels quite tight down there. And now when I rotate round, I can only get to here, whereas I could see behind me before, but I can feel it on that side. Sorry.
No, don't apologize. I mean, I think that's the unraveling. So I think also what I
apologize. That's like
I mean, I'm sure those of you in the self-care saw Rachel took me through a range of motion, and you all know, I got my neck stuff. But what I find sometimes is the area that's problematic is the right side, but I often feel it on the left. So in my first dialoguing, if somebody said, which is my bad side, the side that's harder, it would be I would say the left. But actually, after a couple of times, it's I become more aware that it's the right. So I would, if you were my client, I'd say, well, actually, let's try the other side as the direction of ease and take you through that a couple of times. So it's almost like the peeling of onion, the onion skin.
Yeah,
because also what we're relying on for this is our own ability to subjectively feedback, and this is what's really, it's always been challenging as part of our consultation process is what we can see. Because also if I could go through all of you, I watched you all rotate and loads of people didn't rotate. That is also a thing, right? It's people went into this and then went into lateral flexion, or people couldn't actually get their head to here, but then forced it to go that way. So there's your observation skills that we have to use. And then there's a subjective about what feels tight and then supporting them through it. So it's good feedback, Jill. So you try the opposite side.
Yeah. And actually, I think it's interesting you should say that, because I did feel myself going into lateral flexion while I did it. And that's what I feel now.
Right.
It feels overstretched in that position, so I probably did rotate and then do so. Yeah, it's just
so in that client position, I'd get you come back and I'd really talk you through it, and I'd change your direction of ease. So great. Thanks, Jill.
Yeah.
Thanks, Carolyn.
I think it also emphasizes the need for it's a big difference between offering individual self-care online and people joining an online yoga class, or because you're having an individual targeted consultation. So remember what we're saying on the online self-care course is you actually do your consultation with somebody first, almost as a separate thing, and then you go back a couple of days later with the self-care routine. So, with you, already you would have sort of looked at what was going on with your neck and shoulders, the limit on each side. And also the routine I would have started off with some heat, first of all, which would really help. I'll probably have done something else, before we went into this movement stuff. So, and again, I think the point is, don't be afraid of clients, giving it's really important to get honest feedback from clients. Yeah. So don't be afraid of that. You haven't done anything wrong. It's you can offer the same stretch to 100 people and 99 will find it beneficial and one won't. But it's really important to listen to the person who doesn't and modify what you're doing. So it's not a question of doing something wrong. It just means you have to modify what you're doing to find what is helpful. So thank you for that, Jill. That's really thank you for being a proper client. All right. Okay. Yeah. And definitely the heat. I do recommend the heat first. Right.
Jem is asking a little bit around can you explain a bit why the opposite side helps?
Well,
I would just say it's reverse psychology.
Yeah, I think there's lots of different ways of releasing tissue, Gemma. So one of the kind of principles we work on in the fascia course, with fascia, you can either stretch it or you can almost what we call put it on a slack or compress it. So actually, by rotating the head to the other side, some of the it just almost kind of puts the fascia on a bit of a slack and in a comfortable position, and that just actually helps to it helps to soften it. it does also stretch the muscles on the other side, yeah. But also the psychological thing is massive, because you're just getting people to move, but in a position that's comfortable for them as well, yeah. So there's lots of different potential explanations of why that could work. All right, so with our whiplash client or our neck and shoulder client, start off with that first, because obviously you want to see how that is, if it's of benefit, and that might be week 1 where you're just getting them to do that, you know, gentle kind of movements and increasing the range of movement. All right, so the step up from that is now the towel stretch. So if you want to get your towel and put it around your neck, so look like a sort of vicar or something. And actually, if you sort of fold it so that you can put the edge just below the occiput, yeah? So the edge is just below the occiput, like you're a boxer or something.
Yeah, we're just cool.
Just, yeah, so
yeah,
like.
you become cool as soon as you have it. It's like you're nothing.
Okay, all right, now, this is the only tricky bit about the thing is swapping hands. So listen to what I say rather than looking at me, because everything's sort of opposite, right? So if you should all have your right hand, yeah, on the right towel, okay? Put that towel down and then swap hands. So now the left hand is on the right one, yeah? Left hand on the right one. That's it. Left hand on the right one, yeah? And we all got the left hand on the right bit of towel, yeah? Okay, now the other hand holds the other one down. Okay, all right. So the next stretch, so bearing in mind you want to build things up depending on your client's feedback and their sensitivity. So you start off with the first one. Now the next one kind of builds up from that. So this time we're just going to turn the head, yeah? So we're turning to the left. And then you can use the towel at the end of your range of motion just to give a little bit of overpressure, yeah? And then just wait and hold.
On your chin.
So wait and hold.
That pressure across the jaw feels really great.
Yeah. So just waiting and holding.
Make sure you exhale.
Using the towel. Waiting, holding. Lengthening. Beautiful. And now coming back to center, yeah? And then let's swap hands and take it to the other side, yeah? Remember, those of you with sore necks, we're just taking it to the point where it feels comfortable. So there's no hurt, yeah? It's just that sort of good feeling of a stretch.
Sheila, she's saying I feel a bit strangled. I think the clue is you have to lift the towel up first, so it's kind of just a little bit below your ear, and then have it come across your face, so it's nowhere on your throat. And the towel you're holding in that's more of a
yeah, this is just an anchor.
An anchor, yeah.
Holds it down, yeah? So take it to that side. I'm going to stop doing it and just watch you all. Just make sure there's no strangling going on.
Can I just say something?
Yeah.
I found it when I found this technique, but when I had my neck into almost full range, I could release the opposite side of my towel and put my arm down and increasing the stretch even further.
Yeah.
I don't know if it would work for others, but it worked really well, and I didn't find myself in a untangled position.
Yeah, cool, totally. Yeah, I mean, these are things to play around with.
Or also taking the solid hand almost under your armpit. So that's the other, because you really want to anchor, because remember, it's like a cross-handed stretch. So you're also trying to get this fascia down. So if you let go of the opposite side, you don't have the anchor. So this is actually doing something by coming over the trapezius fascia. You can go under the armpit.
So waiting and holding is always the key. Yeah. Okay. And then come back to center and then just check both rotations again, see how that's feeling. If there's any change. Yeah, Anna Curtis saying having the pressure of the anchor. Yeah, Catherine Dean got osteopathic manipulation there. Well done, Catherine. Charge yourself extra for that. Feels great. It's nice with the towel, isn't it? There you go. Yeah, that one's nice as well, Meg. So we did this one last week with the myofascial stretching. Yeah, so that's also just feels a bit easier with the towel because somehow you get the weight of the towel. Nicola Fata, right shoulder drop. Great. Cool.
Oh, amazing.
I want someone out there as well, not now, but I want someone to do it with a hot towel and see how that works. Yeah, a hot, wet towel that you've wrung out. Try it, because I've only just thought of that, and see how long the towel stays hot for if you were going to do that with a client.
Where am I holding the towel? I've got it lifted. First, I lift up on the occiput, and then take the chin to the chest, and then drawing it down. I have to say I'm also pushing back a little bit. Is everybody doing that? Pushing back a little bit into the towel to create that own resistance. Oh, so
I did a bit of slumping into it, and then my erectors were getting really nice stretch.
Yeah,
it was awesome.
It starts to evolve, right? I'm going a little bit into my lateral. You know, I can feel myself going into a bit of unwinding. You know, it can be quite playful.
Yeah.
It's awesome.
So play around with that. I think the towel is the new way to go. You know,
I'm using a pillowcase, by the way.
So I'd love to see what other things you. Yeah, pillowcase is good. And actually, a pair of leggings I found really helpful because they're sort of nice and stretchy and cozy. So you can also, like that kind of thing. Yeah, it's really nice as well.
Tight, man.
Yeah. So have a play around with the towel. Yeah, long scarf. Because when I started doing it, I found there's all kinds of things that actually were easier using this. You know, that kind of thing. This is a nice one for the thoracic. Yeah, lengthening to thoracic. So just above the elbow. And then again, that's a really nice stretch for the sides of the body.
Rachel?
Yeah.
It's Francis.
Yes, Francis.
I just ask about the neck. In Pilates, when we do a neck stretch, you start from C2. So rather than you drop your eye line first, because a lot of people nod from C7.
Yeah.
Should one bear that in mind, where one's sort of nodding from to start with?
Yeah, I mean,
going forward.
Absolutely. You know, I mean, I think that as a first off, it's just helpful just to get people what they would do generally, and just lengthen that fascia. You know, so if you think in Jing, we always go broad, then specific, and then broad. So actually just tuning people into getting a nice long stretch around the erectors. And then you could make it more precise like that, you know, and you could even do things like, all right, let's feel for that bony bump. Let's put our fingers there and then stretch from there, you know. Put your fingers down one more, stretch from there. So that would be a really nice thing to, brilliant, really good.
Oh,
yeah, okay, great ideas. I don't know if the stretch bands are too stretchy.
I think they're too stretchy.
I think they probably are.
They're too stretchy and too sharp.
Yeah. Okay. All right. Let's do a bit of something for the. Yes, it does work great for piano too, Jill. That's correct. Right. Let's do a bit of something for the ribs. Actually, that's quite nice. So, first of all, let's just do a little bit of an assessment. So, with breathing, when we breathe, the ribs are supposed to come out and in again. Yeah, sort of laterally. So just breathe normally. And just notice any movement of the ribs as they're going in and out. So just noticing. Okay. So a nice kind of myofascial way to increase capacity for breath. So this, so putting your hands on the ribs, yeah. So if you're sort of about to tell off a small child. So what we're going to do is we're going to breathe in, big breath in, and then as we breathe out, we're just going to follow it in with our hands. Yeah, so you're just following the ribs down, okay? So sort of into the body. So just follow in with the hands. And then we're going to breathe in again, but we're kind of going to keep a little bit of pressure there with our hands. So it's like we're actually resisting the movement out. So breathing in, resisting, and then breathing out, following it in a little bit more. Yeah. And then breathing in. And then breathing out. So each time you kind of push the ribs in a little bit, it's almost like you're following them down. Yeah. And then finally, we're just going to take a big breath in and take our hands off. And then just start to notice the increased capacity for the breath. Yeah. So that's quite a nice one, because often people aren't using that kind of lateral movement, that sort of side to side, you know, that movement at the sides of the ribs. Feels amazing, right, Claire? Yeah. So I think then you really get, you know, the sense of, you know, how you can really take a nice, you know, a nice kind of deep breath. Sort of using them. Yeah, bringing attention to tight area, absolutely. If I was using that in a session, so Alison, with your asthma family members, Alexandra's a bit lightheaded. Brilliant. You know, what we do for kicks these days, right? So if I was doing that with an asthma client, other things that I'd add in would be working between the ribs, finding trigger points, yeah, waiting and holding on them. So lots of self-massage around the ribs first, yeah. Alison, yeah. I'd do the neck stretches, because remember the scalenes attaches to the ribs as well, and most platysma stretch. So I'd actually do those, and then I'd do the breathing thing at the end when all the tissues was nicely loosened up. I'd also do those side stretches. Yeah, good as well for COPD class.
And I'm loving Sue Pasco. Yes, baby, do it for yourself. And all your yoga people, that's great to add to your yoga classes. Yeah.
Okay. All right, good. Okay. I'm finally I'm gonna show you your spiky balls are not lost, all your other balls. Okay. So again, I totally encourage you, you know, particularly those of you who are, you know, not as busy as you usually are, to play around with different size, but just use what you've got in your house. Yeah, it doesn't have to be special balls. That's very nice, May. That's a fancy one, isn't it?
It's super fancy, but I've got Williams Sunday socks, and I'm just thinking, are you going to make me put this in this ball and beat myself? That's just come to my
You're thinking of those Thai massages, right? We used to have.
Jane Newman is on. Jane Newman is here today, and she knows all about that. Like, anyway, she used to bring those pumps. Okay.
Okay. So yeah, it can be a tennis ball. Golf balls are helpful for more kind of targeted stuff. So I think it can all get a bit mysterious with the spiky balls, right? People have to think they have to go on these like really complicated training courses, or some special way to work with balls. But if you've got a concept of trigger points, which I know a lot of you had, or fascia, then really pretty much the concept of working with any ball is to, when you've done your assessment with a client, you should, a little bit about trigger points. If you don't worry, I'll kind of do a really simple explanation. But when you've done your assessment with your client, you want to be having some kind of concept of where they might have trigger points, yeah? So common examples might be someone with a stiff neck, particularly that kind of stiff neck that you wake up with. That can often be levator scapula, yeah? So I'll show you a nice little trigger point release for levator scapula. Sciatic and back issues are often the piriformis in the middle of the glutes. Hip kind of issues, glute medius at the side of the hip, is often sort of responsible for that. Yeah, so you don't have to make your trigger point release that mysterious, really. And I would recommend that you play around, once you got the concept of it, actually play around with different size balls for yourself and just experiment with different things, because the creativity in itself, you've got an ache or pain, work on it with some of these methods, see if you can help yourself, and then that obviously gives you a data bank of things that you can do with your clients. Yeah. All right, so working with a tennis ball. So I'll just sort of reorientate this so you can see me on the table. So really, basically, find a sore spot on yourself and then find a way that you can put pressure on it with the ball. So a lot of the time that means using gravity, which is either lying on the floor or against the wall, and I'll show you how to do it on the wall in a minute. So first of all, let's do lying on the floor, right? So I've got a bit of an issue in my glute medius here. So just think about, I'll pretend it's the other one, then I'll still be able to see you rather than turning my back to you. All you need to do, get the ball, put it on the sore spot, and then find a way to apply pressure without it being too hurty, yeah? So that might mean that, if I want to treat the glute medius, put the ball there, lie on my side where the hurty bit is, and then I can use my arm just to adjust the weight, yeah? And then all I do, find the sore spot, wait and hold, yeah? Trigger points retreat to 8 to 12 seconds. If it's more of a myofascial release, you want to just be there for longer. Yeah, so waiting and holding, you can move your position slightly to just fine tune what's going on. Yeah, I'll do my real hurty one. There we go. So I've got a nice sore spot here. I'm resting on my elbow, so I'm not putting too much pressure on it, otherwise it'd be too painful.
I just want to reiterate, that's really important. So you want to encourage yourself and your clients to keep your weight above the ball for a period of time, and then gently drop into it, especially if there's like any kind of inflammation that feels too sore. So that lift is really important before you drop your weight in, and their ability to lift out of it again.
Okay, so just waiting, holding, breathing.
Yeah, that's good.
The tissue starts to soften, you could drop a little bit more into it. Remember, the pain should never be more than a 6 or a 7 on a pain scale of 1 to 10, 1 being no pain, 10 being excruciating pain. So just waiting, holding. Yeah, finding those sore spots. And just really sinking into them. Yeah. And generally, after I've done this kind of work with clients, I then do an appropriate stretch. So if I've done a bit of trigger point fascia work on my glute medius, I then come in and get them to do this stretch, yeah, which nicely stretches the glute medius, yeah. So after that, you can do a nice little stretch.
Oh, is that the one with your arms over in that way? Yeah. Is that the glute med?
Yeah, exactly, Nikki. You can use a softer ball first, then build up to a harder ball. Yeah. Yes, I'll show that in a minute, Jill. Yeah. So, and Margarita, yes, you can use your other leg as leverage. Exactly. All right.
Jane,
so
I think
if it's too painful, what's that?
I was going to say Jane Connolly, I think, unmuted herself by accident, had very good questions around glute medius. So yes, that sort of, I see your face. You're like, was that my voice? But that was good. It was like, yes, that whole lateral side is definitely being stretched.
Yeah. Okay. So I'll show you a couple on the lying on the table, and then I'll show you how you can do it against the wall, because that's absolutely an option, which is why we need to work with our clients. So for levator scapula, stiff neck, yeah, because that can be a difficult one for clients to treat by themselves. You'd show them where the levator scapular insertion was. So you'd want to show them a picture of the levator scapula over Zoom. And then I would say, put your right hand on your left shoulder, if it's your left shoulder, yeah? Where your fingers are, they should be able to sort of feel the top of the, yeah, that superior angle of the scapula, yeah? So that's kind of, then going to put their ball in their hand, that's where you're going to be putting it, yeah? So again, you can do this one lying down. Sorry, can't see me, can you? Yeah,
Everybody
so put the ball there. Okay.
Everybody left shot. You're back in shot. That's good.
Yeah. Okay. And then you can just, again, just roll on it, encourage them to find the place. It also feels really good between the shoulder blades, yeah. And they can move a little bit as well, yeah. So a combination of slight movements and just waiting and holding. You know, again, the best way to teach your clients is to do it on yourself first. Yes, that's right, Kim. Supine pigeon for any yogis out there. It's very good.
And also, if you do that lateral flexion stretch and cross your legs, one foot in front of the other, that will also help get into glute medius on the length.
Yeah. Okay. All right, next one. So this is a classic one for anything, anywhere along the leg, really, but certainly plantar fasciitis. Plantar fasciitis, or indeed increasing hamstring flexibility. Person with a hamstring strain would be useful as well. So this is a classic one. Those of you who are here for the myofascial stretching would have seen this trick, but it's a good one. So wherever you are, if you just want to stand and then come forwards into a forward bend, yeah? And it just doesn't matter how you do it. You just want to see how far down you can go, yeah? So just see how far down your hands reach when you do a forward bend. Okay, so just notice, you don't have to hold it, you're just doing a little bit of assessment to see how far down you can go. All right, now with your spiky ball, I would probably use a golf ball, but I don't know, it's disappeared somewhere, it's rolled off the table, so I'm going to use a spiky ball. All you're going to do, you can either do it sitting or standing, is to actually roll your foot on the ball, yeah? Okay, you see me, yeah? So you're just going to roll your foot over the ball. You can get into the arch, feels really nice. Side, the metatarsals. If you haven't got a ball, guys, just massage your own foot. It's just as good. for the trick.
Oh, so good.
Yeah, feeling good. All right. Swap feet and do the other. So any sore bits, again, you can wait and hold.
You could do it sitting, Margarita. It gives a different kind of experience and probably not as dramatic, but if people have really sore feet, again, they might be, well, one, their proprioception could be off and can't do the balance of one side, or two, they might have an issue with the weight bearing going on one side to the other. So yeah, I'm actually doing 2 sitting right now. Got 2 balls going on.
So a little bit of time on each one, and then recheck, and then just go into your forward bend again and see if there's any difference in terms of how far down you get. Wow, I know, right? Good party trick.
It is a good party trick.
Yeah, anybody get an increased range of motion?
Lima.
Yeah.
Wow. Amazing.
Yeah.
Movements. Yes, much more movement.
Ridiculous
Wow,
difference.
fab. 4 inches. Joe, my gosh, can I grow 4 inches? Fab.
Yeah, good point, Jill. Make sure your client understands they don't have to stand on the table when you demo. No, but that it's just really true. Like clients just do what you do, don't they? Yeah, great. Okay. Cindy's saying your feet were exquisitely tender. So start with something softer. Another top tip, I got this from Meg. Clients with plantar fasciitis, don't you use a cold water bottle, Meg?
Yeah, so clients with plantar fasciitis, I go with 1 or 2 hot or cold, right? Because we know plantar fasciitis can respond to both. What I start them with is, I'm sure all of you know this, you get a plastic bottle, fill it with water, put it in the freezer, and then they have to roll it while they're sitting watching TV or reading a fine book on self-care. So they kind of do that and then move on to the spiky balls, and they kind of like the idea of something cool.
Yeah, cool. All right.
Oh, that's really good, Anna. Anna's saying, Anna, do you want to unmute yourself? Curtis.
Hey.
Hey, baby. How you doing?
Good. You all right?
Nice to see you, Anna.
Yeah. Yeah. I when I do this with clients, I get them to roll down as you suggested, and then I get them to not only sort of notice how far down they come, but sort of just spend a few minutes just really tuning in with their whole body, doing sort of a body scan from their feet all the way up, noticing whether one side is tighter than the other. Yeah. I then, if they notice that one side is tighter than the other, or they've got any particular areas of tension or anything, I then get them to roll out just that side.
Okay.
I get them to spend maybe a minute or two just on that one side. Mm-hmm. Then I get them to roll back down again, and that really kind of gives them quite an impactful sort of difference, and they really sort of notice the difference. Then of course I get them to even out and roll the other side as well. But I would say at least 99% of the time they are kind of like, whoa. Yeah. It's great. It's an amazing little trick.
Yeah, brilliant. Yeah, that's great. Yeah. Just saying, would you use an ice bottle and then a spike ball in the same session? I think it was really painful. I'd probably use the ice bottle to start off with, get them to do that, and then, the next week maybe graduate to a tennis ball.
I use the ice ball as also their homework. Like, that's the thing I'd let them go crazy on their own, and then the spike ball with me kind of thing.
Yeah. Okay. So my other top tip for working with trigger points is, as Jill said, if it's quite painful, if people are putting the tennis ball or spiky ball between them and the floor, the other option is working with the wall. I'm a bit challenged with my furniture here, but I will do my best. So
okay. You
can either just if you want to work the hip or something, just put the ball sort of in between yourself and the wall, and then the other trick with the sock if you put it into the sock and then you can put it over, so for example, to treat the levator scap, yeah, or the rhomboids, yeah.
Can you, Rach, if you kneel, we could see you a bit better. Yeah, and ironically, and then move over towards the door. Yeah, because the chair's in front. Yeah, there you go.
Okay, so the sock, and then you can, yeah, use that as well. Yeah, and you don't have to drop the ball. So that's a sock. It's not about your client with it. And Jeanette, I think, was it you, Jeanette, who had a client with a hamstring strain? So again, think if they put the ball in between the hamstring and either the wall or they lie on it, yeah, so if they're lying on it, they could, doesn't have to be in the sock, but yeah, you could do something like this, yeah, to treat the hamstrings, find the sore points, wait and hold, yeah, until you feel the pain start to release. Yeah. So, we will finish with a little bit of a heart myofascial release twinned with a little bit of a meditation, but that's a good, the sock trick, right? So just to run through what we've done. So for whiplash, we did, first of all, rotation, taking it into the position of ease. Then we graduated to the, yeah, to this one. Okay, working with the towel. And then we did a little bit of stuff for asthma. So there was the breathing one, yeah, coming in and then pressing against, coming in, yeah, to increase the breathing capacity. And then we did stuff with the trigger points, which is just basically finding a ball of the suitable size, and then finding some way to apply pressure that's within the client's comfort zone. And then I would say doing some kind of stretching afterwards. Yeah. Yes, Alistair, I believe it will all be available in a video. Daniel, yes, there's a self-care meeting at 12. Those of you on the self-care subscription course, that will be, yeah.
Could I ask a quick question about the ribs?
Yeah.
After you did the bit with the hands, you mentioned a platysma stretch. And I think there was one other thing you mentioned. Was it something like a lateral stretch?
Oh yeah, well done.
So a nice,
yeah, a nice stretch for that one is just either, just arm over the head, wait and hold. And also sometimes you can almost get them to hug themselves and then sort of stretch away from it. So if there's a particular bit of the ribs that feels a bit stuck, you can also do that. Yeah.
Thank you.
Yeah, no worries.
And the platysma stretch was the one where we dropped down from the beginning and then moved the head from side to side with the lockdown.
Lockdown. Is that your lockdown stretch?
That's my lockdown stretch. It's a winner.
I think he's the winner of lockdown. You did that one really early. That was sort of like Zoominar 2 or something, wasn't it?
I know. And this is the thing I was saying to, I remember we're teaching at some point or talking to a group, and I was like, you often teach from your own position of pain, like things that have happened to you and that have given you such relief, you're really good at. And that is one of the things that I just get so much relief for. So it's like taking the chin in, making sure that this all softens, putting both hands on open, palms on the sternum, locking down into the fascia towards the core, and that takes a bit of time, and then taking you up through extension and then going from side to side and playing with the mandible because the opening and closing of the jaw changes the different stretches from the myofascial perspective.
Yeah. Chabra, a stretch for teres muscle and the lats is that actually. Yeah,
right,
that's a great stretch. Yeah, that will stretch teres as well.